I became interested in hand and upper extremity surgery during my orthopedic training in Cleveland, Ohio. I had the opportunity to work very closely with a hand surgeon who had a private practice there, and he saw a wide range of conditions, all the way from literally infants, people in the newborn nursery, all the way to elderly people who had arthritic problems, and he treated primarily hand conditions in those people, and I just thought this was the most fascinating part of my orthopedic training, and that's kind of why I went on to develop the interest and then went ahead and got additional training in that area. When we talk about the hand and the upper extremity, we're concentrating primarily on conditions that involve fracture work. They can involve industrial trauma, they can involve developmental issues, they can involve arthritis as we get older, and it's anything really from the shoulder down to your fingertips. And hand and upper extremity surgeons are trained to do primarily all those conditions related to that part of the body. Well, currently I treat young patients, sort of 18 years old and less, and sometimes the youngest are literally a few days old. In fact, in clinic this past week I saw a real newborn. So the interesting thing about that is that even though the size is different, the problems can be pretty similar, and that's one of the fun parts about what I do right now. I'm passionate about what I do primarily because I like the interaction with the kids and their families. We have a unique opportunity at this facility at both the University of Kentucky and Shriners Hospital to take care of patients that might not have the usual sort of problems that are seen elsewhere, for example, in a more general setting. And by that I mean sometimes people come to us looking for answers to problems that are not so easy to find. And the challenge for myself as a physician and then my staff that I work with is to develop a treatment plan for these patients and their families that will help them get the best outcome for whatever condition they have. I get to know my patients because I try, at least with the younger ones, and actually some of the teenagers as well too, I try to be not threatening to them. I like to examine my patients in the room by actually sitting next to them, sitting next to their families, sort of making them understand that we're all in this together, and that if they have a problem, whether it's a fracture that we can treat in a cast, or if they have a type of problem that might require multiple surgeries, not only now but maybe through their lifetime, I want to make sure that they understand that we're all part of the same team. We're all trying to work on this together, and so I try to make them as comfortable as I can right from the first get-go. When I first came into practice, when I left my training, I was in a private practice setting for many years, and gradually over time became a Shriners doctor, first as a consultant, then as a part-time Shrine doctor, then initially as a full-time doctor. And I came to realize that one of the unique things about working at Shriners Hospital is that we are totally dedicated to the care of the patient and the well-being of the patient and their families without any regard for other constraints such as financial concerns or equipment concerns or things of that nature, because sometimes in the private practice world you're unable to have as many resources as are necessary for the care of a patient, but Shriners Hospital has always held first and foremost that the patient and the child are number one priority for them, and so they do whatever they can to make sure that that child gets the best care that they can. And I'm happy and fortunate to be part of that team.